We have identified 2,852 persons who have tested positive for dengue. And of those persons who have tested positive, we have seen 265 of them needing some form of hospitalization. We have had, so far for the year, we have had 2 deaths resulting from dengue.
That was Health Minister Dr. Frank Anthony. Dr. Anthony's update came as questions were raised about dengue in Guyana. Last week, he said preliminary findings suggest that Burby's siblings Vishnu Mohabir and Ariana Mohabir succumbed to complications related to dengue fever. According to him, the Health Ministry has noted a surge in dengue cases and has taken key actions to help mitigate the situation. Increased fogging is among the actions taken. Based on the more than 11,200 tests done, a majority of the cases are concentrated in regions 1, 2, 4, 6, 9, and 10. Dr. Anthony did not say what regions the persons who died hailed from.
Persons might get fever, and they would attribute that to getting flu, so they don't bother to come to the health center, to the hospital. If you have a fever, we are encouraging people to come to one of our facilities so that we can test you, because you don't know what is causing the fever. And we can test you, and then we can advise you accordingly.
Last year, Guyana also experienced a surge in dengue cases. In August, the newsroom reported that there were 11 dengue-related deaths for the year up to that point. Of that 11, there were at least 6 children who died. Chairman of Region 6, David Armagon, spoke on the issue earlier this week.
Month or so, we have had quite a number of children coming in with dengue at the hospital. Some were admitted, some were treated and sent home and so. But the thing is now that parents are rushing with their children to get to the hospital very quickly. As soon as they find that their children come down with fever, they're not taking any chances anymore, which is a good thing.
The World Health Organization has said these increased infections are in part linked to global warming. Increased temperatures are said to be conducive for the breeding of the Aedes aegypti mosquito, which spreads the disease and thrives in stagnant water.